Hey everyone, and welcome to MedSnap RX. This is a question series of Step 2 CK style question vignettes that we're going to go through that each tackle a topic that you're probably going to see on your MBME web-based test if you're a current medical student, or maybe if you're trying to take your Step 1 or 2. So let's get started. So here's our question. We got a 32-year-old woman. She's coming to the emergency department with a 2-week history of fatigue, some shortness of breath on exertion, and some palpitations. She doesn't have any fever, no weight loss, or night sweats. She does, however, have a history of heavy menstrual bleeding for the past 6 months. She hasn't had any recent trauma or gastrointestinal bleeding. She has a balanced diet and she takes no medications. So you do your physical examination. She appears pale with a heart rate of 110 beats per minute. Her blood pressure is 110/70 and her respiratory rate is 18 breaths per minute. Whenever you further do your physical exam, she has pale conjunctiva. She also has a systolic flow murmur, and you can see her laboratory results below. So now on to the question. Which of the following is the most appropriate next step in the management of this patient? Do we want to order a peripheral blood smear and retic count? Do we want to give some iron supplementation? Do we want to do a colonoscopy? Do we want to transfuse 2 units of packed red blood cells? Or do we want to do a bone biopsy? Alright, so I'll give you a little while to pause and then we'll go on to the next slide. Alright, so the answer was B. So I've highlighted a couple of key points in this question stem that I really think you need to pay attention to as you're walking through. So I would definitely first suggest to read what is the question asking you first. We're looking for the most appropriate next step. And if you're not used to Step 2 CK questions or these shelf questions, this will be a very common thing that you're asked. Whenever you go back to the question, you see that our patient, she's a 32-year-old woman. She's got fatigue, shortness of breath on exertion. She's having heart palpitations. She's pale in her conjunctivae, which are the red parts around your eyes. And then she's also been bleeding really heavily for the past 6 months. You look at her labs, and if you've taken Step 1 or have this preclinical knowledge, this should be screaming anemia to you. So the classic patient that's going to come in, it's going to be a woman around her 30s, normally around 20 to 40. This is a very common vignette for this type of question. She's going to be having fatigue, this shortness of breath on exertion, and occasional palpitations. And as you notice in the pertinent positives that we also have these pertinent negatives. There's no fever, there's no weight loss, and there's no night sweats. So it's kind of taken us away from malignancy, potentially. And then the key point, she's been bleeding for 6 months, and it's heavy menstrual bleeding. This could also be GI bleeding, which is why whenever I designed this question, I put that she doesn't have any recent trauma or GI bleeding. Her diet's correct, so we're not really thinking that it's a nutritional deficiency, and there's no medications causing this. Whenever we did our physical examination, the pale findings accompanied with tachycardia and then a systolic flow murmur all indicate anemia. So these are very, very important whenever you're going through these question stems and you're suspecting anemia. And a really great test taking tip is that keep a tally. You can either write it on your piece of paper or in your mind. Whenever you have your differential diagnosis list, put a tally next to every time something supports one of those things in that list. Here, you've probably got 8 to 10 things just in the question stem that are telling you anemia. Then we move on to the labs. So these are all pertinent, if you see. And on a test question, they're probably not going to give you all 6 of these. They might give you 2. They might hint at it in the stem. I just wanted to include them here for completeness sake. So if you see any type of anemia question on test day, whether that's shelf or for step, you're going to get it right. For your hemoglobin, 7.8. There's your normal. That's very low. Anemia picture. MCV is microcytic. That's an anemia picture. Your RDW, your red cell distribution width, it's 18%. A really key thing to see is that they're going to try to test whether or not you know, is this a thalassemia that we're looking at, or is this an anemia, like an iron deficiency anemia? Our width is higher. Same thing with our MCV being lower. You're going to think, this is probably going to be anemia. Anemia, that RDW is going to be higher. Thalassemia, it's going to be lower because that's a genetic problem. And the MCV typically is like in the 60s. It's very, very microcytic. But don't just go off of that. Read your question. For your ferritin, it's incredibly low. It's below 10. So that's already making you think we don't have iron. Our serum iron's low. And our TIBC is high. We have a lot of capacity to bind iron, even though we don't have it. All right, so now that we've gone to the question, let's see if we can start ruling out some answer choices and figure out what's right and what's wrong. Alright, so here's our summary slide where we're going to kind of talk about why was B the correct answer? Why not A, C, D, or E? So let's start off with A. Why wouldn't we get a peripheral blood smear and a retic count? So that probably would show you anemia, right? If you looked on a blood smear, you'd see some microcytic cells all in different stages of their growth cycle. And if you ordered a retic count, you'd probably be producing cells as fast as you can to keep up. However, is that beneficial for our patient? Is it telling us anything that we don't already know from the clinical picture? So yes, this technically is like a correct test that you could do. It's not the next appropriate step. And what's going to happen on these shells and on step 2, or step 1 for that matter, they're going to see if you know what is appropriate. Not is it correct, what is appropriate. Now for B, for oral iron supplementation, and this, I took this out for the original question, but refer to gynecology. This is the most appropriate. We know that she's having anemia, and it's probably due to low iron. We need to start her on some iron supplementation. And with that menorrhagia that she's happening, we probably need to go ahead and refer to GYN for further management. Why not the colonoscopy? It kind of follows the same level of thinking as B, but she's not having any GI bleeding. And you have to trust, like if a patient tells you this, you probably want to work it up in the clinic, or if you're an inpatient, you want to see if she's really having that hematochezia or melena as well. But I would really highly recommend on these tests, whatever the patient tells you is the truth unless they're indicating otherwise. So for C, we're not really thinking it's a GI bleed. Let's leave it there. To transfuse 2 units of packed red blood cells for D. So this kind of tests the point of, do you know the transfusion thresholds? So you've probably heard it on inpatient. If not, you're going to hear it now. 7 and 21. 7 for your hemoglobin and 21 for your hematocrit. Those are the classical levels in which you would transfuse a unit of packed red blood cells. Our patient here is at 7.8. She's not below the threshold. She's getting close, so it probably would be something, or maybe reasonable, to get a type and screen on our patient if she continues to go down, if this is an inpatient setting. But right here in this outpatient setting, it is not indicated. Would we order a bone marrow biopsy? Well, that could potentially result in an anemia, but that would be like an aplastic anemia. However, this is a pure red cell problem, as we've evidenced. And sometimes on these questions too, they'll give you more lab values so that you can make that assumption as well. But she didn't have any night sweats. This isn't a chronic issue that she's dealing with. This is likely developed over the past 6 months because she's losing a lot of blood. All right, and that's all of the answers. So now hopefully you can see why B was the correct answer. If you have any other questions, as always, please put it in the comments below. And I'll be making a series of these questions as well. So if you see a vignette that you like, or maybe you see a vignette that you're a little bit unsure of, or you've seen a patient that had the exact same chief complaint, go ahead and click on it. These questions were probably going to be under 10 minutes, and hopefully you'll get it on your test and you've learned a little bit too. Bye now.